if you are deficient of insulin, what's really happening that paradoxically the blood sugars levels are high in your blood vessels, but your cells are hungry. So what insulin does, brings the glucose from your blood vessels back to the cells and makes your glucose levels back to the normal, and ultimately treats your diabetes. Sugar control is deteriorating in spite of the oral medications, and most people, we suggest that if you're taking more than 2 combination of oral medications, should be going on insulin. Those patients who require special type of surgeries, those patients who are having repeated infections, those patients who are losing weight should be going on insulin. Type 1 diabetes, which is only solution is insulin. The oral medication does not work. So that class of people won't have any choice just to go on insulin. A lot of people have their fear of insulin. They think that insulin is going to be lifelong. Insulin is going to be the last stage of diabetes. I keep telling my patients, look, once you wear glasses, you're going to be lifelong glasses. And I keep saying, look, if I'm off the glasses, I can't read properly. Once I put my glasses on, I can read properly. Will you call me dependent on glasses? No, I'm not dependent on glasses. I need my glasses to read. So once I put my glasses on, you can tell me that, look, doctor, you're dependent on glasses, but that's not the case. I need it to read it. If I take it off, my vision would go back to what it was before. So it's very important that you take insulin like that. So insulin, once you go on it, yes, once you go on it, you're most likely going to go in for long term, but mainly because you require it. Now, certain class of people who may require a short-term insulin treatment, mainly in the hospital stay, and sometimes in the infection periods, may come off insulin. So insulin, you don't have to be on long-term. But yes, most people in outpatient settings who have failed oral medication treatment, lifestyle changes was inadequate, would eventually lead on insulin all their life. We meet a lot of people who say, Doctor Saab, insulin suit nahi kar rahe mujhe. I don't think so. It's like, if you drink water, the thirst would go. So if you inject insulin, if it's properly stored, properly injected, the blood sugar would come down. The point is how much dose, how you're injecting, and what type of insulin. Your doctor would decide what type of insulin what you need. And there are different type of insulin in way of the little older design and in way of modern insulin. I must add, there's not major difference between these 2 insulin. And some insulin, the newer design insulins, the major advantage that you can take just immediately before meals compared to other older designed insulins. And there are newer insulin which has been designed which can last up to 24 hours. So there are advantages of the newer designed insulins. Now at the same time, you have also different types of insulin. One is a short-acting or a rapid-acting insulin, which works for a couple of hours. One is intermittent acting, works for 12 to 14 hours. And one is the longer-acting insulin, which works for 24 hours. And there could be also a combination of a short-acting insulin and an intermittent-acting insulin. And the more insulin would come up in future. So your doctor would be able to decide the appropriate treatment, the type of insulin, the injection therapy. And it's very also important to know that insulin treatment is a little dynamic. It's not that once we decide a dose, it will remain dose for next 6 months' time. We also need to titrate up and down based on your blood sugar requirement, based on your blood sugar control and your glycated HbA1c. So insulin needs to be titrated based on how the blood sugar tends to be going on in next few weeks' time or few months' time. And you should be in a regular touch with your doctors and diabetes educators regarding your insulin titrations and insulin treatment. Once you have diabetes, I keep saying to my patients that if I were a diabetes, I would not keep away from insulin, but I would like to keep away from the complications of diabetes. So I do not call insulin as a complication of diabetes. So insulin is given mainly to keep the complication away. And it's the most important part and stay of treatment in most patients who have long history of diabetes.